What we're going to do is trach suctioning, which is a sterile technique. So you'll have your, where does it say it on there? It doesn't say it. Anyway, it looks like this. It has sterile gloves in it. It has a little container to hold your solution. If you know that these aren't going to fit you, you can bring in your own sterile gloves. You have your solution. You want a pulse ox, and then, of course, your stethoscope. And so you would come into the room, hand hygiene, introduce yourself, provide for privacy. You would take your orders, verify their name, date of birth, and allergies. And you want to talk to them, let them know what's going on. So today we have orders to suction your trach. And so we're just going to see if you need it. You don't ever want to just come in here and suction if they don't need it, because you have the potential of introducing microbes and bacteria and stuff into their trach. So we don't want to do that. So the way that you know if they need to be suctioned is you'll take your pulse ox, place it on the finger, and then you want to listen to breath sounds. So I would listen to all my areas. Okay, and so I might hear some crackles, some bronchial secretions and stuff, so that's going to let me know. And then maybe if you look at their pulse ox, anything below like 92% is a good indication that you need to suction. So I'm going to leave my pulse ox on there, and while I'm getting set up, you want to hyper oxygenate your patient. And so what you'll do, he's got his oxygen going into here. Like right now he's set on 2 liters. We're going to go all the way up to 10. Okay, and then I've got my suction canister. Remember to put on gloves if it's been used before, because you got to test your equipment. All right, so we want to set our suction 80 to 120. So we're going to do continuous, or the regular one. We'll, dial it in to where your indicator's between 80 and 120, and then turn it off. When we test it, remember, put your thumb on the end of it and make sure it's got a suction on there. So we're good to go. So our equipment's set up. They're hyper oxygenating right now. Now we're going to move over, and we're going to start setting up our sterile field and stuff, okay? Hand hygiene. All right. So I've got my saline right here. You want to check expiration, clarity, make sure it's the right solution that you're supposed to use. So the first thing we're going to do, open this up. Bring that out. So as you see right here, this is the container that you're going to pop it open and pour the solution in. So you just want to grab it here at the bottom. Squeeze like that. Open it up. So what we're going to do, I'm going to set it right there so we can have it close to our working area. Label to palm. It's been used before, so I'm going to lip it. 6 inches above, we're going to pour some solution in there. Okay, now we're going to put our sterile gloves on. What you've got on the inside here is your sterile gloves, and then you've got the actual trach tubing. And so you've got to kind of work with it. You want to maintain control of your tubing right here. I'll just kind of of wrap it around. So what you're going to do is you're going to commit your non-dominant hand, and you're going to connect it to your suction tubing. So what I do, I get control over here, pinch it right here. I'm going to go ahead and commit this hand. It's going to be dirty after I touch the tubing. So this hand can only touch this tubing. It cannot touch this tubing right now. So we're going to connect it and make sure we don't contaminate. Okay. This thumb is the only thing allowed to touch this tubing. And the reason you do that, see the opening there? When you close that opening with your thumb, the suction's going to come out of here. Okay. So I'm going to go ahead and turn it on. We've already listened to them. We've got our pulse ox on there. You want to lubricate the tubing. So I use my thumb and I'll suck up some of the solution. Okay, maintain control. So I'm going to go ahead and I'm going to start suctioning. We'll move the oxygen over. You don't want to touch the outside of the trachea with this tubing. You want to go directly in the center. And you're going to advance it down until you feel some resistance. And that's where the bronchioles separate. You do not suction on the way down, okay? Whenever you hit that resistance, intermittently, you're going to put your thumb over here and you'll start twisting and kind of pulling it out. Make sure your hand doesn't touch the trach because remember, it's got to stay sterile. Walk it out, okay? So 10 seconds is the longest you need to do. On the way out, only suction when you're pulling it out. You want to put the oxygen back on there, let him reoxygenate, and then you want to clear your tubing. Then we want to listen. Put it in the ears, listen all of our places. Okay, he still sounds kind of junky in there, so we're going to suction him again. I've already cleared my line with the solution. Take off the oxygen. Okay. And we're going to walk it in. I feel resistance. And I'm all the way out. Put the oxygen back on. Clear your line. We're going to listen again. You don't want to suction any more than 3 times. And you need to verbalize that in your checkoff. So he sounds pretty good. So we don't need to suction him again. Okay. We've cleared our line with the fluid or the solution. So I'm going to turn this off. Disconnect. And hygiene. And then you always want to make sure you turn your oxygen back down to the previous setting. So we'll put him back on 2. And then we're looking at our pulse ox, making sure his oxygen saturation came back up. And he's at 95%. So we're good to go on that one. So that's how you suction. If you come to the point where you've suctioned 3 times and they still sound really junky, they've got the crackles, and you can hear the moisture and they're coughing and stuff, that's when you want to contact respiratory therapy. They've got some other tricks that they can do that we can't, and they can come in and suction, and they put like saline solution down in there to help loosen up some of the secretions. So after 3 times, we would contact respiratory. So you'll come in and just check on them, make sure everything's okay, and then do your XYZs, hand hygiene, putting the bed down and stuff, and then come back and check on them, and that's it.